Good afternoon, everyone, and thank you all so much for joining us for AltaPointe Health's first ever Facebook Live event. We're so excited to be coming to you today in recognition of Children's Mental Health Awareness Week. We know that now more than ever, with everything going on during these uncertain times due to the COVID-19 pandemic, we know that you all will be turning to mental health services more than ever before, and that includes for our children as well. So today we've got some very exciting guests with us. We have two experts from AltaPointe Health. We have Mr. Eddie Pratt, who is a therapist and coordinator for AltaPointe's day treatment services in Baldwin County. And we also have Ms. Nicolette Harvey, who is a licensed independent clinical social worker, as well as our assistant director for BayPointe Children's Hospital. And they're going to join us today just to kind of talk about what are the behaviors we can expect to see from our kids, what's not normal, what are those red flags, and what do we need to do next if we know that, those are happening and we need to go to the next level. So we're going to cover all of that for you today, but we also want to invite you that if we have time after we cover all that, we'd be happy to answer some of your questions. So feel free to submit some of those in the comments below, and if we have time, we will do our best to answer your questions that you may be seeing or going through at home during this time. So first of all, Eddie, I want to thank you so much for being here with us this afternoon. We're excited to do this. It's the first time ever, so bear with us. Hopefully everything's going smoothly with our technicals. And so Eddie, the first thing we want to talk about is what are those behaviors that can be expected of our children right now? This is a new time. I know as a mom who's been working from home, trying to teach from home and fill all those different roles, we've had a lot more emotional meltdowns, some stubbornness from the kids, and it's been an interesting time to see them adjusting to this. So what as parents can we expect?
You're right, Katie. It's a challenging time definitely for parents, for kids. Everybody's livelihood has pretty much changed. And we're seeing a lot of parents stressed because not only are they being parents, but they're also being teachers and working with teachers. And also teachers are working an insurmountable amount of time day and night to educate kids. So, what can be expected is, there can be a lot of anxiety and sadness. Kids are their daily routine, seeing their friends at school on a daily basis is no longer a daily habit. A lot of kids who are enjoying sports or athletics, it's softball and baseball season, and a lot of kids are disappointed that they can't play those sports right now. So there's a lot of uncertainty.
And how does that manifest itself in the kids? Can you expect some anger, some outbursts, the meltdowns? What will that show to the parents?
Right. There could definitely be some unusual symptoms of maybe frustration or anger. Some of these behaviors that we're seeing with the kids are normal for what's going on. Parents are stressed, and a lot of that can affect the children, because the best indication of a child's mental health is definitely what's going on at home with the family. So if parents are stressed, it could affect the kids. But yeah, if kids are going to be angry because they can't go see their friend across the street, they might be upset about a math problem where they used to have the teacher in the classroom to give them guided instruction, but now it's through either Zoom or Google Classroom. And so, these are some things that, I see and experience every day, because in the day treatment program, we had kids that came and saw us, every day, and a lot of them miss us. Typically, we used to hear about kids not liking school, but now they like being at school because they're stuck at home with mom and dad or grandmother or grandparent.
Absolutely. So what are the red flags that parents ought to be looking out for? What are those behaviors that are not normal for this time?
Yeah, that's a good question. Katie, I think some of the concerns that we have, typically kids at times will become maybe sad or anxious. And if I had to really define those symptoms in a very simplistic way for our viewers today, anxiety is fear or worry about something that may or may not happen in the future. And the reality is everybody is going through this pandemic together. So there is naturally a lot of anxiety that people are experiencing. The other thing is sadness. It could be guilt. It could be depression, or the things that they wish they could have done in the past. Those are probably the most common mental health problems among kids, anxiety and depression. However, from time to time we see kids that may be experimenting with drugs or alcohol, so that can be problematic also.
Okay. And talk to us a little bit about what are some things that we can do as parents? What are some coping skills or
Oh, yeah.
strategies that we can try to use to help our kids when they are feeling upset?
Yeah, good. Katie, I think the best thing that we can do for our kids and for ourselves as parents and caregivers is definitely parents, take care of yourself. Spend some quality time doing what you enjoy to do, whether it be 30 minutes or an hour, whatever time that you can spend enjoying yourself and, going out as much as you can and talking to friends. But definitely kids need to engage in activities with their parents. With the social distancing, there's, kids are not able to talk or maybe touch or play, but I think the important thing, what I'm seeing clinically is kids really need to have that physical contact, that touch, that love, that unconditional positive regard that they can get from a parent or a loved one, and let them know, hey, I'm here for you, I love you, and have that open dialogue with your kids. Tell me, how are you feeling today? A lot of times we just kind of say those things just haphazardly, but really spend some time with your kids, or spend time with each other, and just try to spend that time each day, because time is the most valuable commodity that we have right now, especially in taking care of our kids.
Are there any other things we can do as far as I know I've tried to create a schedule for my kids to keep
Oh,
some
yeah.
sort of balance and norm going on at home? Are there little things like that that we could do to help?
Yeah, that's good. As we know, school is still continuing to resume. So I think it's very healthy, and I've talked to a lot of parents that say, look, whatever schedule that you had for your regular school day, go ahead and implement that at home like you're going to school, because that's not going to go away. But definitely having a consistent schedule, kids in uncertain times, they need some consistency, some type of normalcy. They need secure attachments. They need trusted people that they can talk to. And very simply, I think structure is really good. Time and spending time with other people is really good. With the day and age of technology, it's really important that families or kids, text their friends and just say, hey, look, I'm thinking about you today. I care about you. If you need anything, let me know. So yeah, structure is really good, and taking time for self-care, that's really important too.
Okay, perfect. So let's talk a little bit more about those red flags that we were talking a little bit about before. Can you be more specific as to what are some, is it when they get to what point?
Right. If when we talk about anxiety, depression, if it becomes so severe, and I teach a course called Mental Health First Aid here through AltaPointe, and one of the things that we look at is we want to assess if a child is having thoughts of self-harm. And so if a child is having thoughts of hopelessness, or writing things that are very concerning to the parents or loved ones, or they're isolating. A lot of times, the phrase live, laugh, and love. You know, Sometimes we think about if a kid is really struggling with those areas in their life, they may need somebody to talk to. They may need some help. And so AltaPointe is here, if that need is necessary.
Okay. Well, thank you so much. I think we're going to get ready to swap on out. We'll have Miss Nicolette come on in. We're trying our best to do social distancing, so we're doing one at a time. So we'll have Miss Nicolette come on in. Eddie was kind of talking to us about, those warning signs, those red flags, that once you do see them and the coping skills and the strategies just aren't working for us as parents, what's next? What do we need to keep in mind moving forward?
Okay, thanks, Katie. Hi. You know, we're really fortunate, I think, in this community to have a really robust system through AltaPointe Health Systems to offer mental health for children and adults. So with the children, we have several options. We have a fantastic CarePoint hotline that's an access to care for our entire community that can route them to services. So when you're seeing things like hopelessness, irritability, aggression, anger in your child, suicidal ideations, children reporting that they may feel like they don't know what good they serve here, or life would be better without them, which we know is not true. You can contact that Access to Care hotline, which is 450-2211. I'm sure we'll say that again, 450-2211. And they can redirect you to services to help your family, because we do believe that children's mental health is a family issue. Children's mental health is a family mental health issue. So we have support services. We have children's outpatient services that can direct you to physicians and therapists outpatient. And we also have BayPointe Hospital, which is an acute stabilization unit for children in crisis. We work really diligently with the families and the children that come into our hospital unit for a brief time period that keeps them safe. They see a psychiatrist, they see a therapist daily. They're all for group therapy, and we work through family therapy. And we also help them plan for resources that might be causing some of these stressors in the family's life. So we can utilize BayPointe Hospital or outpatient services for those families in need.
Awesome. I know we really are very fortunate to have BayPointe in our own backyard, because the next nearest similar hospital might be over in Dothan or up to Birmingham. So we are lucky that we have that right here, that if those kids are in crisis, those families can stay here in our community. What are some of the things that you guys see at the hospital? What level does it get to when the kids need to come to BayPointe?
Well, thank you. That's a good question. One of the things that we recognize is that every family is at a different level in engaging their own child in their own struggles. So BayPointe Hospital is actually available for children that have escalated to any level of aggression in the family home, significant defiance that puts their safety at risk. We have children that report feelings of suicidal ideations, or sometimes they engage in self-injurious behavior. And anything that a family is not able to manage safely in the home environment, so they can't guarantee that they can keep their child or loved one safe for a long period of time, they should use that 450-2211 hotline, because they can connect them directly to a hospital setting, and we can make sure that our environment is secure, it's safe, it's monitored by nurses 24/7, Happy Nurses Week. We appreciate y'all. And we are able to keep that child safe while they stay connected to their family. With this whole pandemic going on, we have implemented Zoom and telehealth family therapy and psychiatric appointments through our hospital setting to keep not only the child safe, but also the family safe from the pandemic.
Yeah, and speaking of telehealth, I know that's being implemented across the board throughout AltaPointe Health. So how is this making it easier to access mental health services for people from the comfort of their own home?
Well, they don't have to put on pants with buttons, so that's number one. You can wear your pajama bottoms, but we are, all jokes aside, we have set up all of our outpatient and inpatient children's facilities with access to the telehealth field. So it's fantastic. You know, technology is great. If this would have happened when we were kids, I don't know where we'd be, but we have the webcams and things available for our families and our children to have appointments with their therapists if they have already established mental health concerns. And we also have other things going on that we can intake new appointments. So our hospital, our outpatient continuum, everything is being done safely through telehealth services, so we can facilitate that.
Okay, awesome. Can you real quick talk to them a little bit about when they call that access to care number, the 251-450-2211, what can they expect when they call that number?
Well, they can expect good customer service, because we have crisis specialists that are trained to deal with families and children that are in crisis. So you will be able to connect to a live person that can help with what you're experiencing right now, and that has experience in the field. So we're really proud of that hotline. They can have a person's voice on the line. That person will immediately connect them to the right level of service. If the child is in crisis, they can set up an immediate phone screening for the hospitalization needs, and our admission discharge nurse will call them right back with a screening for hospital, and then give them all the details of how to admit a child. We're also doing all of our admissions via phone or distancing, so that we can keep people safe.
Yeah, awesome. So talk a little bit about the stigma surrounding mental health, and just let everybody know that it's okay to seek help during this time. It's okay if you've never needed mental health support before.
Yeah.
You know, now is the time. It's okay to turn to help.
Right, and you know, this is hard. Like, it's hard for all of us. I know it's you said it's hard for you as a parent. I'm a parent. It's hard for me, and it is okay, because right now we're in unprecedented territory. No one knows what to expect or what's coming next, and I think that weighs heavily on a lot of people. So we have very confidential and supportive programming set up at AltaPointe Health System. So we want you to know that if you feel like overwhelmed, if you feel like this is too much for you, if you feel like your child is not adjusting well or a family member is not adjusting well, reach out to us, because we're here caring and supporting you through this difficult time. I think everyone in our country has been great at pulling together to do what they can do to support each other, and this is what our role is to be here for you, to reach out when you need mental health services.
Okay, awesome. Well, thank you so much for that. I think we'll swap out one more time, bring Eddie on back in. And Eddie, when you come back in, we kind of want you to talk about, we're here today because it's Children's Mental Health Awareness Week. Why do you think it's important to have this week to really address these concerns and make more awareness surrounding the mental health concerns in our kids?
Right. You know, Children's Mental Health Week is a very special week. Tomorrow is actually National Mental Health Awareness Day. So I think recognizing that, mental health issues affect everybody. A lot of people, in the medical field and everyday to day people, some people may struggle with cancer or diabetes or heart conditions, and people treat those as real medical issues. And we talked earlier about stigma, but you know what? A lot of people, 1 in 4 American adults each year will experience some kind of mental health problem, whether it could be anything. And a lot of those things affect our kids. So the emphasis on Children's Mental Health Awareness Week and Day is really just to let everybody know, hey, look, mental health problems are real. Depression, anxiety, drug and alcohol issues. People usually don't wake up on a Saturday morning and want those things to overcome their life. The same thing with cancer, diabetes, and heart conditions. So we need to reduce that stigma, and that's really what Children's Mental Awareness Day and Week is letting kids know and letting parents in the community know that everybody currently with this pandemic is struggling, that has a lot of anxiety, a lot of uncertainty, but we just need to really focus on taking care of our kids, because kids are little adults in training. So we just need to make sure of that.
Right, that was my next point, was to say that addressing these issues while they're children will hopefully set them up for a better, successful future down the line, rather than, letting the issues become a big problem and then erupting as an adult.
Right. I mean, you're right, Katie. I mean, in doing this for 20 years with AltaPointe, I have seen kids that are now adults, and they never said, "Hey, Mr. Eddie, thank you for that good grade in 3rd grade." They say, "Thank you for helping me during the most darkest times of my life," and that's really important, and that's rewarding for what we do. And I'm very blessed to share this information and get this word out to the community, because this is really important. Suicide is something that a lot of people don't want to talk about, and it's taboo, but it is something that we have to manage and we have to talk to our kids about, because I have been through multiple crises over 20 years with the BP oil spill, with Hurricanes Katrina and Ivan. And recently, just this school year, there have been several kids who unfortunately have taken their life. And so this is what this is really about today, is focusing on every child's life matters. And everybody needs to be included in. So if you know somebody, a child or a loved one that is struggling with any kind of emotional, behavioral issues, if their ability to live, laugh, and love their life and those around them are dwindling, or they're having problems, definitely please call AltaPointe. That number, I can't stress it enough, 450-2211. And also make sure you can follow us on Facebook at AltaPointe Health, or you can go to our website at altapointe.org.
All right. Well, thank you all so much for joining us today. Thank you, Eddie.
Thank you, Katie.
Thank you, Nicolette, for your wonderful expertise. We hope this will help someone out there in the community who may be on the fence of deciding, whether they need to seek help, whether they need to help for more resources. So we hope you all know that AltaPointe Health is here for you during this time. Again, that phone number is 251-450-2211. You can find us on our website, altapointe.org, or you can follow us on Facebook and Twitter as well. So we hope you all have a wonderful day, and happy Children's Mental Health Awareness Week.